when it comes to so anxiety and nutrition, so understanding how, as a dietitian, how we're preventing it, how we're treating it. So the first thing off the bat is always that nutritional assessment. So I want to know, of course, exactly what they're eating, and not only that, but also what they're drinking. And as we'll look at with anxiety, caffeine can play a huge role. So I need to know, are they drinking a ton of sweet tea? Are they drinking a ton of coffee? Are they getting plenty of water? So that beverage is just as important to me as the food is. I want to know what supplements they're on and if they're really taking them, right? Because I know for me, it's like, yeah, I take a multivitamin. Not every day though, so we need to know, what supplements, if they're taking them. And then medications, because there are food and medication interactions that can occur. There's anxiety, anti-anxiety medications that can cause diarrhea, it can cause constipation, nausea. And so those are issues that deal with, how well they're eating and intaking. And so I want to know if their medications are having any of those effects. Of course, their eating patterns, if they're getting their meals or if they're skipping meals, not eating at all. I want to know allergies, because I'll show you some what I call brain food, things like nuts, where we know there's a huge lot of allergies out there for tree nuts and peanuts. So to know their allergies, any therapeutic adjustments. So this comes with viscosity of beverages. So this could be if a patient is in a hospital and if they have issues with swallowing, that maybe they did have a stroke. And so we are able to have, those thickening agents so that they prevent that aspiration and maybe things that may cause them not to want to eat because they're just nervous and how that's being ingested. And so we have to look at that as a dietitian. Bowels as well. So the health of a bowel can tell us just as much as what's going in. We want to know what's coming out. Food preferences and taste aversions, because I don't want to force any food on someone if they're not going to eat it or if they just can't. Socioeconomic status, my background is with the food bank, and so that's always I key into that. Can you afford what I'm trying to teach you and the foods that I'm trying to incorporate into your diet? Any type of barriers, of course, and then religious beliefs. And so, if they are Jewish and they can't do, dairy and beef together, or if they do a lot of intermediate fasting because of their religious practices, we need to know that as well. A lot of our patients don't just have anxiety, right? They just don't have one thing you're treating. They have a lot of comorbidities in this area, a lot of diabetes, hypertension, kidney disease. And these medical conditions can cause a lot of anxiety around food, particularly irritable bowel syndrome, IBS, Crohn's disease. Those patients, they're scared to eat in a lot of instances because they don't know what's going to flare up. And so working with those patients is key. And then also kidney disease. They're also very concerned with what they're consuming because it is a little bit more limited diet when you come to reducing the phosphorus, reducing the potassium in their diet there. So settings for treatment where dietitians can treat, and so psychiatric facilities, group homes, early intervention programs, outpatient, patient's home. And so much of my talk is going to be more with like your outpatient, since in a hospital you have stricter protocols to follow. Okay, so considerations when I'm interacting with these clients. And the first one right off the bat is identify a pattern in food recall. And I'm going to spend some time with food recall just so, because really this is the base of how we gather our information. And so this is a very detailed food recall. The more detailed, the better here. This is only for breakfast and lunch, and so we're missing some data here. But in a food recall, I want to get as many days as I'm willing to get. Sometimes I only get a 24-hour. So thinking back yesterday, everything they ate and drank, what time. I'd rather them fill it out as they go along, just because we do tend to forget. 3-day would be great if I could get a 3-day recall there. But your recall is always going to have, I want to know what time they're eating, because if maybe they're sleeping and their first meal is 10 in the morning, which to me it's like, oh, well, is this the start of your day? Is this breakfast? Maybe they're not eating until 2 p.m. Is it just because, you're not hungry up until that point? So I want to know what time that they're eating, what the food or beverage is. I told you that I want to know their beverage. And as you see here, coffee, the quantity as well. So 2.5 cups can be, for some patients, that could be quite a bit of caffeine. So I need to know how much, so the quantity there. And then this is where I get really specific, but again, I need to know the method of preparation. So if you told me, I had some peaches, well, was it canned? Was it fresh? If it was canned, was it in heavy syrup? Was it in its own juice? That's going to dictate a lot. If they tell me, I had chicken, well, in my mind, I want to think, oh, you had chicken breast, like you had healthy protein, but in actuality, probably fried chicken that they got at Chicken or wherever. Yeah. So we need to make sure that we iron that out and we get all the information there. And then the last piece of it is, where is that food consumed? Are they having it at a table, or is it a lot of times it's going to be, they're by themselves, they're eating alone. They may be, food may be a comfort to them when they do have anxiety. So a lot of it can be done hidden and away from people. And so trying to put that social interaction back in there too. So when I talk about food recall, this is what I'm referring to. All right, so going back to considerations. So overall appetite, so how well they're doing, again, if medications are affecting that, if they're skipping a lot of meals, eating disorders, which can, it can be a subset of what they're experiencing. So if they have, the irritable bowel syndrome, or if they have, diabetes or any kind of fear around food, as the nurse mentioned, talking about, the thyroid too. And so hyperthyroidism as well, we can see a lot of weight loss with that. And so it may not be specifically an eating disorder, but we're seeing weight loss, and we need to address it. Any type of, obesity, again, food can be, especially when you get into processed foods and a lot of sugary foods, it releases that serotonin, right, that feel-good hormones. And so we could see obesity linked with it if they're over-consuming. Again, the comorbidity, so if they have diabetes, if they have hypertension, blood glucose, and I'll show you in a little bit, but when it comes to our mood, when it comes to how our brain functions, we want to keep blood sugar levels consistent. So whether they have diabetes or not, because if we have a ton of sugar or a ton of carbs, especially simple carb, we get those spikes in blood sugar. It takes a while for our body to kind of get back and adjust. So even if they don't have diabetes, I want to keep blood glucose consistent because that does affect their mood. I need to know their caffeine intake, since it can really jump their anxiety, and also alcohol intake. Now, alcohol it's a depressant, right? And so, for some of these patients that are experiencing anxiety, they kind of start relying on alcohol because it does calm them down. But where I see that kind of anxiety kick up is when they have those withdrawals, or when they're relying too much on alcohol, and so that can, of course, turn into substance abuse, and we don't want that. Keeping tabs on that. Cooking. So if they're, this kind of self-efficacy, if they can cook, if they do cook at home, since a lot of the diet comes from healthier, more you can cook at home, the healthier it's going to be versus eating out or picking up that way. Vitamin D deficiency, and this is something I apologize. I should have also mentioned it when we talked about depression last month. Vitamin D deficiency being linked to depression, also with anxiety as well. And so, it's such a huge push that even our food labels that we have on all our food products, we're going to start seeing vitamin D as one of the vitamins for the daily value, that and potassium. And so those new food labels, they're coming out, some are already coming out, but by 2020, we'll start seeing that on there. So even in South Texas, even though we get plenty of sun, most of us in here probably have vitamin D deficiency. And so trying to pull it more from our diet. Social anxieties. If they can't be in a crowded room, if they can't go into a grocery store because there's too many people there, I need to know that, because that's of course going to affect the way they cook, the way they eat, if they can only, salvage enough courage to go through drive-throughs. Social anxiety can be a huge thing. Any type of phobias as well. If they're concerned with handling knives, with cutting and sharp objects because they don't want to, go back to that state they were, if they're, kind of in that spot where they're struggling a little bit, that's something that we want to know. Of course, if there's depression present, since those can be very linked there. And then exercise. So thinking about their overall health, not just what they're eating, but also, are you getting any movement? Are you getting outside? Are the considerations. All right, so goals and related interventions. And so my goal as a dietitian, I don't want them skipping meals. I want them to keep consistent with it. And so I always say eating every, at least every, 4 hours, but 3 to 4 hours to be consistent in blood glucose. More brain foods, and I'll show you what those brain foods are. I want to incorporate those. Reduce sugar and processed foods, just for overall health, overall energy. Reducing, eliminating that caffeine or that alcohol intake. I want to keep that blood glucose normal. I want them to cook more meals at home and kind of get used to that. And even cooking can be very therapeutic, right? So even that can have a calming effect. Just being able to get, hands on some food, hands on some vegetables, and cook something up. And then exercise. So a great goal would be, 1 to 2 days a week for 30 minutes. Now, if they're starting from, doing absolutely nothing and just staying in their house, of course, every little success is a success. So even if it's just 5 minutes, going outside, walking the backyard, I'll take it. But, slowly building that up. So interventions, of course, the goal setting. So once we kind of see that food recall and see what adjustments we can make, then we can set our goals to, so whether that be, can you get in, 1 brain food at each meal? Can you get your, walk, your 10-minute walk in, after lunch? Checking, logging blood sugar. If they do have diabetes, if needed, if they can check it, I want to see those numbers as well to see if they're fluctuating. And then that might be a goal too, that they do check their blood sugar more often. And so online grocery shopping, so this goes back to any kind of phobia. If I find out that they can't be in a crowd, hey, there's options here. We can get our groceries online. We can do curbside now. It's awesome. Amazon, with grocery, Amazon.com. So getting them, into that exercise log or app, again, to kind of track that and goal set. All right, so specific nutrients. So this is what I call my brain food. My brain food. Okay, magnesium. Magnesium, so whole grains, oats, seeds, nuts, peanuts, leafy greens, yogurt, dark chocolate, greater than 70%, okay? I know there's a lot of, they try to push that, just because it's dark chocolate, it needs to be greater, 72% or greater would be ideal. Of course, it gets more bitter, and that's why we don't tend to prefer it. This is going to have our magnesium here. So this is, so all these nutrients help to kind of relieve that calming sensation, helping release that serotonin, that dopamine. Omega-3s. So we talked in depression about omega-3s, even anxiety, huge here. So supplement 1 to 3 grams per day. So this is an easy thing to supplement with some food sources: salmon, tuna, grass-fed beef, and dairy. So, the grass, their grass diet allows them more omega-3s. What's interesting, though, about the grass-fed dairy is it could look more orangish, just because of the more beta-carotene in their diet. And so, for people not to freak out that, if my milk looks a little orange when it's grass-fed. But it's, great quality. Flaxseed, chia seeds, walnuts, all good sources of our omega-3s. Polyphenols, and so this is our antioxidants. And so this is a huge push here, but all my berries, so strawberries, blueberries, raspberries, blackberries, cherries, plums, apples, spinach, broccoli, Black beans, black olives. You know, with fruits and vegetables, darker the fruit or vegetable, healthier it is. Same thing, even with your olives, even with your beans. The darker that outer layer is, the more nutrition you have there. So, soy milk, soy yogurt, and also turmeric as a spice, good source of antioxidants there. But, you know, the one main thing I just tell any class I teach when I'm in the community is just have berries in your fridge, because that's always, berries and eggs, right? That's always the big push there. That antioxidants too, they're going to decrease that oxidative stress that is occurring, and so that's where they do their job the best. And these magnesium foods also have your B vitamins, and those are your energy producing vitamins. Those are the ones we want, and so we're getting energy in the right sources, not just from sugar, which you know, sugar can increase epinephrine tenfold when we have too much sugar there. So this is our whole grains. And you're going to see some repeat here. So gamma aminobutyric acid, so your GABA neurotransmitter foods that help release it, yogurt, fresh cheeses, so none of that Kraft singles garbage, which isn't even
so
cheese.
Good to grow cheese.
If you've ever looked at Kraft singles, they cannot use the term cheese because it's not a cheese. It's less than 50%. So they call it singles, Kraft singles. So it's not called cheese at all. Yeah. So it's not even a food, right? Food product. So real food. Want real food. So almonds, bananas, and citrus, broccoli and spinach. You'll see that there again. Brown rice, oatmeal. So again, that's going to have magnesium in there as well. And then your probiotics. So your probiotics, so that's including a lot of your fermented foods, right? So yogurt, pickles, sauerkraut, kefir. But 95% of your serotonin receptors are in your gut. And we know gut health is just exploding with research, and so that's the direction it's heading.
Watch out what it's fermented in, though, because if it's fermented in sugar, you're getting in trouble with your sugar levels.
Okay, that's good. That's good. Zinc, cashews, beef, eggs, vitamin D, so you can get it through your dairy, enriched cereals, mushrooms, as well as eggs will have your vitamin D there. So some we've seen a few repeats. So measuring outcome success, so again, their food recall, their food journal, including that at least one grain food in each meal. And as you saw, that's a pretty good variety. I mean, it's easy to get in, especially with the nuts, just something like 1 ounce, or with like your spinach, it could be half a cup. So it's not huge portions here. Of course, balancing the diet, limiting that sugar and replacing those simple carbs with those whole grains. Elimination or reduction of that caffeine or alcohol. Stabilizing blood sugar, cooking at least those 1 to 2 meals at home a week, and then exercising 1 to 2 days per week for 30 minutes.
Can I ask a question about the caffeine?
Sure.
So one of the things that I do find is a lot of folks, when you're talking to them about their anxiety and you talk to them about the things that they eat and they drink, I mean, we live in South Texas, like iced tea, if it came out of the faucet in the kitchen, would be like ideal, right? And so, I talk to my clients, not just young adults, but also kids who say they drink ice. It's just, they always grew up, they always did. Having those conversations about a beverage that has been so culturally nested with these folks, are there any tips that you can give us other than it's not a good deal for you?
Well, the one thing, the sweet tea is kind of what I first work on. And I know, just case study, my husband grew up drinking sweet tea from here. And so, reducing that to, a fourth sweet, started a fourth of unsweet, 3/4 sweet, and then, half and half, and then down. So now, unsweet tea is like tolerable.
That's what I do.
Right.
Yeah. And so I go with that angle first. So if it's a sweet tea, we're trying to reduce that. And then a lot of times when they get used to that unsweet tea, water isn't such a big leap wheat because,
That's right.
yeah, it's pretty similar, but,
I have them divide it into either half sweet and half non-sweet if they've been drinking sweet tea and they
Yeah.
can't break it up.
yeah.
Have them mix it a little bit or water it down.
Yeah.
Because our taste buds are so adaptable. I
Yes,
mean,
yes.
just within, 3-4 weeks,
So,
if we.
I understand the strategies. What
Right.
I'm asking about is
It's so ingrained.
having that conversation about why this is important to
Why?
do,
Mm.
and it being a convincing one.
Yeah.
What do you think would be some tips?
I mean, it depends. It's that whole readiness to change as well. I mean, if it's really impacting them, if this, if this caffeine, if they're really addicted to it, and if it's really causing issues, I mean, of course, that's what we're going to bring up. It's going to make you feel better in the long run. If there's some things that you just can't touch because, like, this is what I'm going to do no matter what, then that's fine. Then we'll see a different approach, or maybe it's, adding in, just healthier foods there. Or if there's other certain food or things we can talk about that it's where it's out of sight, out of mind, but it does depend on the individual. That some of them, like, I can't go there, and it's like, okay, fine, this, eventually we'll get there, eventually, you'll want to keep everything else in alignment because you're, working in these areas, but, yeah. And that's okay, it's not going to be 100% success.
I
all
would think the
time.
journal might be a really good way to help open their eyes a little bit.
Yeah.
And sometimes you can motivate them a little bit with an herbal tea, because some of them can be kind of like fruit based, if
Yeah.
it's sweeter, and then you don't
Yeah.
have the caffeine in it, so.
Yeah. And just, I mean, 100 milligrams of caffeine in, like 8 ounces of coffee, and so, recommended about 400 milligrams like per day for an adult. But of course, it can affect people a lot more.
Well,
So
what does it do to you? What does caffeine do to you?
yeah, so what it does is just make sure that you have plenty of energy. So it actually blocks the adenosine, and so like with your cyclic AMP, it allows it to just continue producing energy. Since anyways, breakdown of energy takes some time, caffeine bypasses that. And so that's where your like heart's racing, you're epinephrine, norepinephrine, that's all pumping that fight or flight response. That's what it's
So
producing.
it's like sugar, but it's
Mhm.
caffeine.
And I know for me, like I
Okay.
can't do caffeine
Oh,
because I
it's
get
just a
that. I get,
reaction,
panic
a reaction
attack
of the
feeling,
person.
yeah, heart racing.
Oh.
So
There's actually some people who are more sensitive to it than others,
yeah.
and it
Yeah.
caffeine interferes with your magnesium absorption. So you have to make sure that you're taking it with enough time. If they insist on drinking caffeine, you have to be a 12-hour difference, or you're not getting the magnesium absorption from your supplements and the foods that you're
Yeah.
eating.
Yeah.
So it's kind of null and
Nutrients like to
void.
compete. So I'm out of time. So communications from you, just your assessment as our nurse was talking about, that all teams need to be on the same page. That's when it works the most. So whatever information you can give us, nothing is too trivial to how we approach a patient. So please just, key in whatever you have, of course, identifying phobias. And then I always go back to what they're drinking, and just this last story to leave you with. We had a patient who on their food recall would write down like ice cream. They were eating ice cream like 3-4 times a day, just a bowl of ice cream. And when we were really addressing it, it finds out that he was actually drinking, like a 6-pack and trying to disguise it as food because it's like, oh, it's not as bad. Doesn't sound as bad, even though I know like ice cream's bad for me, so is alcohol, but I'm just gonna put down, ice cream.
Ice cream.
So that's where, it.
So a bowl of ice cream was a 6-pack and then.
Wow. So that's where, nothing surprises us anymore. But more information you gather, the better for us. And with that, thank you all so much.
Thank you.